Hello, everyone. We're just going to get everyone situated and we'll get started in just a moment. Thanks for joining us today.
Hi.
Good to see you. Thanks for being here today.
Of course. It's good to talk about this. It's always nice to do these things 6 months before the session.
Absolutely.
You're right about that.
You have
Yes.
to prepare.
Well, we're so glad that it worked. I know you both are really busy, and we're so grateful that you're just willing to take some time to spend with us. So
Sure.
Thank you again.
Here we are.
Doing our thing. We talk every day practically.
There are people, a lot of them, who think that we don't do anything during the interim. And Kathy and I talked this morning about the fact that this has become a full-time job, which that's okay. I don't watch soaps, as I've often said, or play bridge. So, but
I like to play bridge.
But sometimes it intrudes into the things that we might also like to do. So,
yeah.
All right, Sarah, you just let me know when you want us to get started.
I think we can get started anytime now. It looks like I had kind of given Senator Hogan and Senator Lee a little bit of a heads up that we will be recording. We have a smaller, more intimate group, but we do have over 150 advocates that will be receiving this recording. So we're very excited to be having you as guests to give us, I think, a deeper look into our discussion of SB 2149. But I'm going to hand it back over to Sam. So Sam, if you want to kind of kick it off, we'll kind of spend the first 15-20 minutes or so just giving an orientation introduction. So we'll just kind of let her have the floor.
All right, everyone. Thanks for joining us today. This is a very special treat. So we do have our guest speakers. Just to note, we are going to do some background information on AFSP and advocacy before we go into our meat and potatoes of today of our guest speakers. Do want to also, we will introduce our guest speakers when we get to that portion, but live on the call, we do have quite a few of our AFSP North Dakota chapter board members. So shout out to Dr. Blem, shout out to Barb Hansen and Sarah Dukart for joining us today, who may have some of the questions as we get started. So we'll start with some background information before we get into our special guests and our questions, really the main kind of event for today. Getting into it again, welcome. We're glad you're here. Most of you will be watching this as a recording. This is a great preparation to State Capitol Day that will be in February 2025. Okay, so just what this hour is going to look like. We will give you some opening remarks. We'll start talking about a little bit about AFSP, do some advocacy 101. We'll talk about why we fight for the cause. We'll be talking about AFSP specifically. And again, but most of all of you are here for our featured speakers, Senator Judy Lee and Senator Kathy Hogan. We'll also go over some questions, and then I will talk briefly about some of the AFSP events coming up this spring and this fall. So you'll hear from me, Samantha Christofferson. I'm the executive director for AFSP for North and South Dakota. We are all here today because of Sarah Dixon Hagee getting this organized. So thank you. Sarah Dixon Hagee is our public policy ambassador. And then we also again have our guest speakers from District 21 and District 13. We will just jump into some basic information about AFSP. As most of you know, AFSP is a national organization, and we're dedicated to suicide prevention. It's our mission at AFSP to save lives and bring hope to those affected by suicide. We started as a small group of families who wanted to know more about suicide prevention and research in 1987, and now we have grown to a national movement of people in all 50 states, including Washington, D.C. and Puerto Rico. AFSP is made up of loss survivors or people who have lost a loved one to suicide, Many individuals who are part of AFSP have lived experience and have personally struggled. And the great thing about AFSP is we are a background of all kinds of different people. Some of us are mental health professionals, some of us are high school students, some of us are legislators, some of us are school counselors. We're a group of a whole bunch of people coming together to save lives and bring hope to those affected by suicide. Again, we started as a small organization in 1987, primarily focused on research, but we've really expanded today. Today, the American Foundation for Suicide Prevention, of course, combines science and grassroots, and then we have a network of advocates and volunteers across the United States. Also, again, we are from the North Dakota chapter. We serve the entire state of North Dakota. AFSP is a voluntary health organization that gives those affected by suicide a nationwide community empowered by research, education, and advocacy. And of course, our work could not be done without our advocates and our volunteers. So thank you for being here today. Again, we're very active in research on the national level. On the local level, we're active in prevention education, advocacy, and support for loss survivors. Just for a little bit of background information, of course, we do great work at AFSP, prevention, education, advocacy, and support. But just, I think it's really helpful when we're very blunt, so it's not confusing. So AFSP is not a crisis center. We do not run support groups, and we don't make grants to other organizations, but we are a dedicated national organization that works in research, prevention, education, advocacy, and support for loss survivors. So now we're going to go over some national and state stats that highlight the need for advocacy efforts today. So do want to note, we get our information from the Center for Disease Control and Prevention, also called the CDC. The CDC collects and shares data on number of suicide deaths in the United States each year. It does typically take about 2 years for the data to be published, so we have the updated data from 2021. In 2021, we know that we lost 48,183 Americans to suicide. It's the third leading cause of death for ages 10 to 19. It's the second leading death for ages 10 to 34. It's the fourth leading death for those ages 35 to 44. And on the national level, suicide is the 12th leading cause of death. Over 1/3 of people who die by suicide were 55 years or older. And it's estimated that for each suicide death, there were 25 other attempts, equaling more than 1 million suicide attempts each year. Here's a copy of our national fact sheet. You can also download this information at afsp.org/statefacts or afsp.org/statistics. Here is specific information to North Dakota. In 2021, we lost 156 North Dakotan residents to suicide. It's the second leading cause of death for our young people. It's the second leading cause of death for ages 25 to 34. The second leading cause of death for our people 35 to 44. And overall, suicide is the 9th leading cause of death. Again, you can get the information at afsp.org/statefacts or afsp.org/statistics. Here is some information that we got from our North Dakota contact. This is the information coming directly from the North Dakota Violent Death Reporting System. So this is a bit of updated information, but we do know that suicide has been increase in suicide death rates in North Dakota from 2019 to 2022. On average, the statewide suicide rates have been higher than the national average by 42%. Approximately 3 North Dakotans die each week from suicide. 82% of the suicide deaths were males. Nearly half of the suicide deaths were middle-aged adults, aged 35 to 64, with an average age of 41 years old. Approximately 28 had previous suicidal thoughts, and 16% had a history of suicide attempts. 25% recently disclosed suicidal thoughts or intent to die by suicide prior to death. Of course, statistics are important because they help us see the scope of the problem of suicide and kind of helps us prepare for our conversations. So for our advocates online and for our advocates who are watching this recording, let's move into talking about how, as an advocate for suicide prevention, how you can make a difference. So located in Washington, D.C., the AFSP Public Policy Office advocates at the state and federal level for policies and legislation that help to reduce suicide and improve mental health. Public Policy Office works with the chapters across the country to identify policy priorities for each state, some of which you will learn about today. And collectively, the American Foundation for Suicide Prevention has over 45,000 volunteer advocates nationwide who are supporting suicide prevention efforts at all levels of government. AFSP volunteer field advocates make an impact in many different policy areas for suicide prevention and mental health. Policy priorities are determined every 2 years by volunteers on the National AFSP Public Policy Council and the Public Policy Office staff in Washington, D.C. And then, of course, it's approved by our AFSP National Board. To get more information, you can visit afsp.org/priorities. Again, that's afsp.org/priorities, and find out more information on our policy issues, as well as view and download a full list of priorities. There's also great resources for you to use. You can use our legislative website. Again, that's a great tool for members of Congress and legislation at the federal level. You can go to www.congress.gov. For your state legislators and legislation at the state level, you can go to that website, which is www.congress.gov/state-legislator-websites. And you can also use that website to learn who your legislators are, how to contact them, and how to get connected to their newsletters. And you can find out what laws are currently in place in your state or federally, and what bills are being considered to become laws. And then you can learn about specific legislation process that's specific to North Dakota. You can also use the AFSP Action Center to identify your legislators under the My Officials tab. There you will be brought to a list of your representatives at the federal and also the state level. You can click into each individual to learn more about them. The Action Center is you can access on your mobile phone or your desktop, and you can utilize it in preparing for any legislative meeting that you may have in the future. Of course, you can, under each elected official, you will find a brief profile, party information, the office phone number, as well as social media handles. You can also let the Public Policy Office know if you meet with one of your elected officials or have an existing relationship with them, and you can log that and help get support that way. The Public Policy Office has an action on the AFSP Action Center. You can check out this event and this resource at afsp.org/action center. And then when you click on the Action Center, actions in the Action Center, you will be able to be matched to your legislator and get their information. Okay, and again, I will hand over to Sarah Dixon Hackey to officially introduce our special guests.
Thank you, Sam. Well, and I'm so glad to have just both of you. I kind of stated that in the beginning, but I know the two of you have been powerhouses in this community for quite a long time, even before the formal titles. So it truly is a pleasure to have you. We have Senator Judy Lee and Senator Kathy Hogan joining us. Let's see here. Next slide, please, Sam. Hope she didn't go away. There we go. Keep going there. All righty. So one of the things I certainly want to touch on is, I think, the large body of work that both of these individuals have done for our state. If we look at Senator Judy Lee's work over really the tenure of her experience, she certainly has been a member for quite a long time, since 1995, and served on any number of committees that have made dynamic impacts in our community. She is, and correct me if I'm wrong, please, also the chairperson for the Human Services Committee. So a lot of great things that I think she really is the lead in. Next slide, Sam. Senator Kathy Hogan is also someone who has been really serving in a public forum for a long time. Her experience really was in the Senate since 2019, but she was in the House prior to that. And so her body of work certainly has encompassed a number of different fields. You can see here in her kind of exhaustive list of committee membership that she has really touched a number of corners in terms of what matters to our state. So beyond that, I really wanted to just hand this over. I know Senator Lee and Senator Hogan are not only colleagues, but also friends. I recall when I met with Senator Lee a while back, she playfully said that we've been doing this dog and pony show for quite some time now. So we've got it down pat. So I really just want to hand the floor to you. If I can just, kind of give you a little bit of background. I know I'd sent you just kind of the overview of the issue brief. I know it was a little bit long, but it really kind of gave a taste of, what we were supporting in terms of this last legislative sessions. And a key one, of course, was SB 2149, which is really that funding for 988. So I'm just going to let you have the floor. And if you would maybe just kind of walk us through what that looked like and, anything that kind of encompassed that process.
This is Judy Lee. You missed the fact that Senator Kathy Hogan is also the minority leader in the Senate, and that's another big deal, actually. And she was a sponsor of this bill. I was a co-sponsor. So, Kathy, why don't you take the lead on what this bill was intended to do, and then we can chat about it. That be okay?
I'm totally comfortable with that, Judy. I think the thing about this bill is we've worked, both Judy and I have worked with First Link since the late 1980s before any of us were doing politics, because we were involved in the establishment of First Link and the conversion from being part of United Way. So we've been deeply linked to the fact that people need access to help. And so we've worked on this for, well, that's 30 years, Judy. We are old, 40 years old. That's really
That's okay. That's experienced.
That's experience. And so as I listened to your background on suicide, prior to being a legislator, I was in human services. And I was recalling the one week when I had 3 direct suicides, either 2 with my clients and 1 with a friend in 1 week. And once you've been impacted by suicide, and that does impact staff as well as it does family and other survivors, this has been a long time passion for both of us. So I think we come to it with a perspective that understands that there are so many layers of suicide prevention and intervention that's the issue. There's not one answer. There are numerous answers. But after the passage of the federal efforts at 988, which we strongly supported, we looked at our current response system, and particularly at First Link, and how their capacity to respond to both the increased number of calls, and then when they get calls, are there resources behind them to actually do intervention and help? And as we introduced this bill, we got numerous stories from families who said, I called and no one responded. And as we heard those stories, we realized that we needed a much stronger response system. And so we looked at all the other states that had done this. And particularly, we were looking at how do we get a designated funding stream for First Link? But we wrote the bill, and Judy, correct me if you're wrong, but I think we've got this together. Yeah. We wanted it not just to be the first telephone response, but then who do they refer to? How do we ensure intervention and necessary support systems? And this is building out an entire crisis intervention response system. And then in addition, you want to do prevention and you want to do follow-up for survivors. But we looked at all the other states and we worked closely. Sarah, you were on that team, and we worked with First Link. We worked with the entities in the state who were directly involved. And we came up with the plan that many states are doing, which is a fee on cell phones. And when we did the first draft of the bill, and I think, Sarah, you followed this pretty closely, we hadn't figured out the logistics of how to do cell phone fees. And that's more complicated than, it's not in our pay grade, someone other than us, because we have the ideas of program, but the logistics. And so the first draft was very broad and very general. The second draft of the bill, we worked with the people who regulate telephones and cell phone numbers and figured out how all the states are doing that. And so 2149 was a really good exercise because it really made us put all the pieces together to establish a fee on every cell phone or every phone, every line, to fund response. That was the intent. And those early hearings were a lot of families who just said this needs to happen. And there was very clear support for it. And in the Senate, the sponsors got engaged. The nice thing about this bill was we generated a broad band of sponsors. We worked with the other bills that were introduced on suicide, particularly the Suicide Fatality Review Committee, which was a really second piece. There's all kinds of pieces of suicide prevention, intervention, review, all of that. And so we tried to network with all of those people. And I think the bill was appreciated and supported by a large number of people until the communications people got into it and said, we don't want a fee on our phones. And then we didn't have a bill anymore. And so is that a fair analysis of what happened, Judy?
Absolutely. And when I was talking to somebody this morning about this, and yesterday, that the idea was they didn't come to the hearings, at least in the human services, because obviously it's in policy before it goes to appropriations. I shouldn't say obviously, I'm just stating the way it works. The Human Services Policy Committee was supportive of this and and talked about and added actually an amendment that would provide an appropriation. Excuse me. But the phone people lobbied in the hallways, in the cafeteria, the people on appropriations, and kind of got them a little stirred up. And we didn't have, because we're not in that committee where we're doing our own work, we tried, I think, to intervene, but it wasn't successful. And then we did actually get it to the House, although the appropriation wasn't in there. And there was activity in the House that was supportive, but they also were, we were the ones broadsided, I guess, but they were the ones who also got the hammer from the phone providers, or the communications providers. So anyway, what came back in the end is a bill that did not have an appropriation, and it ended up in the Department of Health and Human Services. So they have established the structure. And as Kathy reminded me this morning, that the Department of Health and Human Services has a structure set up, but the problem is, so that's there, but the problem is that they are not adequately funded. So we're going to think about running this up the flagpole again and see if we can get enough people to salute in the 2025 session.
I think it was one of the few times, Judy, when people didn't come to the committee and oppose a bill, but did it all in the back room behind us. And
subversively, yes.
Subversively. So we didn't see it and we couldn't respond. No. And that doesn't happen very often in the legislature. And it was one of those learning experiences for us. And it also shows it's hard for an advocacy organization to compete with a big lobbying organization. And so
they're everywhere. It isn't that there are so many of the people, but they represent every square inch of the state. So there's a senator who has now retired from a business which has a large network, including phone service, and he's on appropriations. And so he was certainly lobbied by his colleagues, and he was able to get a few more people to agree with him in the conversation. So that's part of the challenge, and we're not stupid. We figured this out, and we'll see what we can do the next time around.
Well, I think, and I love your kind of just pragmatism about this. I think it is fascinating to hear, even at your level of experience, that there are still things that can kind of come up and sneak up on you, right?
Yep.
And I think you really nailed it on the head when you said that as an advocacy organization, we don't have a professional lobbyist out there working the hallways like some of these entities or corporations. And I certainly want to open it up to those that are in attendance. So I know Sarah Dukart, and we've got Dr. Blem and Barb, who's also in healthcare. All three of our board members here. So I really want them to have an opportunity to ask questions. But I'm curious from just a general perspective. I mean, as community, nonprofit volunteer advocates that we have that are going to be listening to this, what is your best recommendation for what we can do to support the work that you're doing?
Make friends with your legislators. And
Yep.
the thing that we found out with this bill that was really exciting to me is Michelle Axman, who is a freshman senator. And she is a strong advocate that we didn't know about until the process went on. And
she's a nurse and military. She flew fighter planes, and she's now
fighter planes.
Yes. So anyway, she is a nurse and she is an advocate. So we now know that we have somebody on another committee that also is helpful.
And you might want to look at particularly the floor debate on the bill to see who were the people who stood up and supported this bill, because it was a beautiful hearing, particularly on the first reading, Judy, because we were counting votes. We were trying to figure out, could we keep this alive, and what were our options. But some of the floor debate, and so figure out who your friends are right away. And then the information that you started this session with was excellent. And particularly the North Dakota specific information, because our rates of suicide are so high, and the second leading cause of death. It's like, this is terrifying. And so figure out who your friends are, and that you have to get involved in the political process. And it's not meaning Democrat or Republican. It's you just need to know your legislators and figure out who your friends are. And teach them about the issue.
The other thing is that it's a whole lot more effective to have people talk to folks that are in their own districts than it is to have somebody come in from out of town and tell us what to do. Doesn't matter how smart you are about it. You can certainly be there as a part of the picture. But the advocates who will be watching or are listening now, at every opportunity I have to meet with groups, and there are lots of them over the years, and Kathy too, I always say, find out who your legislators are. I'm not asking you to raise your hands and tell me that you know that they are who they are, but go home and find out who they are. Invite them to coffee, or see if they'll at least give you a few minutes of their time just to introduce yourself. Don't ask for something right off the bat, but it's just becoming acquainted. This is for the constituents who live in a district. We've got fewer than 15,000 people in a district, so everything is 2 degrees of separation max. And so if somebody from the home district contacts their own legislators about this and says, this is a real concern, are you aware of the fact? And everybody knows somebody or knows about somebody who's committed suicide. So, and there are some families that are very strong advocates. I'm thinking of the trainers for one. Yeah. Anyhow, those are the people who should be talking to their own legislators in 47 districts about why this is important. So those people who live in North Dakota, whether it's rural or urban, and the picture is the same everywhere from the standpoint of having to address this, those are the ones who need to talk to their own legislators. I get calls, and Kathy does too, from all over the state, because we've been around since God was a little girl, and they just figure we know what's going on. But they also need to talk to the people who are in their own district and who are going to be voting on this. And right now, we have a very tumultuous election period going on. And so what's going on in the June 11th primary is in large part going to determine who wins in November. So it doesn't hurt to wait until that November election, I guess, to figure out who's serving, because there's we have, is it 11 senators that aren't coming back out of 47, I think? Yeah.
Yep.
And the House has a big group too that are not running again. And there are some that who have not been endorsed, who are wonderful advocates, who have been turned away by their districts out of foolishness and are now challenging in the primary. And we hope that some of our good human services friends who have been turned upside down by I was going to use a phrase that wouldn't be very flattering, but by the far right wing people. I'm a Republican, she's a Democrat. Neither one of us like the people who are on either extreme, but there are more of them on the right extreme right now here. So, and we're not the only state that has that problem. I spent a little time in Florida this winter and it's very much the same there. But they have to talk to their own people. That's the deal. So whatever you can do as advocates around the state to inform your own constituency, and have a couple of people come in who have experienced it if they're willing, and there are some who are, to testify in the committees, and not just policy, but appropriations also. But we got to get everybody, because everybody votes on it.
Mm-hmm. And the effective lobbying, particularly in committee or when you're meeting with a legislator one-on-one, is storytelling.
Yep.
I mean, I was just thinking about the stories that we heard in that first 2149 committee hearing that touched the mother from, I think she was Rugby, just was so profound that, you can't say no when you hear the stories. And the effectiveness of stories, I think sometimes, data is helpful, but stories are what touch our hearts.
You have to put a face on it.
You have to put a face on it. And the more directly involved people who have been impacted are, the more powerful the story. And that's a hard thing to do, but it works because you can't deny the pain that people have experienced.
And we're not scary.
And our particular committee is not scary. Some of them are.
We're quite proud of the fact that we're not.
And even people with strongly disagreed agreements, we are respectful to each other, and we don't play those games. And so Judy runs a very tight ship. And
we like each other.
And we like each other
the same. Yeah.
And so it's important to know the culture of the committee you're going into if you're testifying. Those are things that are helpful, and to build your allies before you testify. And you can, I mean, I love it when people in committee or before committee send me the 3 questions they want me to ask the people who are opposing this bill.
Yes.
We all get those kind of things. And those are little techniques that I was in a committee meeting sometime in the last 2 months, and I kept getting these text messages saying, ask this question, ask this question. Like, okay.
Oh, and sometimes they're good questions.
They're really good questions. And those are techniques that if you haven't lobbied much or you don't know about the process, you don't realize that we want input so we can make good decisions.
And we have 80 days every other year, and we handle almost 1,000 bills and resolutions. So there is no standing around. It moves quickly because it has to.
And with term limits, you're going to lose us eventually. And
in 6 years, we'll all be gone.
We'll all be
nobody
gone.
Left in the legislature in 6 years.
And then no one will have the history that we offer you now.
No.
And so when I retire, my effort is going to be overturning that term limit issue. That's my public service commitment, because as a citizen legislature, it takes you at least 2 full sessions to understand the process, let alone the content. And so that's just going to have to happen, or we're going to have government run by lobbyists, which you guys have experienced already, the effectiveness of big lobbyists, and an administrative branch that doesn't always. We're pretty strong advocates of the legislature making policy.
We pass the laws and we appropriate the money. We keep telling the governor that. He gets to sign the bill if he wants to, or not. or he can veto it and then we can overturn it or not. But he suffers from thinking that he is in charge, and this separation of powers, which Congress has got all screwed up too, but the fact that there actually are 3 independent branches of government, it's really critical to making the best decisions. So we're pretty possessive about the power of the legislature, and it isn't that we don't communicate with the governor. That's not it. But we don't have to do what the House says. The House doesn't have to do what we say, and we don't have to do what the governor wants. And that allows us to independently in each of our sessions consider what else has been brought to the table and see how we can bring things together. And of course, in conference committees, then the 2 houses will have 3 members each who try to work out the final details of something. And speaking of that, it was ultimately defeated after lots of permutations of this bill in the Senate, but it was defeated because we wanted it to be at that time. By that point, it had gotten to be, well, you go ahead, Kathy, and explain it because you were talking about it this morning.
Yeah. Well, and in the end, the bill did nothing.
No.
And so sometimes we say, okay, what we wanted, I mean, it wasn't against the idea that we acknowledged that there were major needs in suicide. It actually did nothing. And because it did nothing, we just said, don't put a bill which does nothing. And so it died unanimously. And it kind of killed us. But at the same time, many bills get introduced 2 to 3 sessions before they're passed. And I think I had a bill to eliminate the income tax on Social Security in 2013 and introduced it 2013, 2015, and it passed this year. It didn't have my name on it anymore, but it's the persistence of don't give up on what you do. I mean, Judy, how many times have we seen bills over and over and over before we get them passed? And a lot of people,
and we'll tell the people on the committee, this is what happened, 7 years ago or 5 years ago, and this is what led us to this. And when that's lost, it's just going to be, well, less good stuff happening. I'm sure. Yeah.
That's right. So
nobody loves it.
Oh, sorry. Go ahead, Sam.
We'd love to hear questions from you too.
Yes, for sure.
Yeah. Tell us what you're.
This has been really helpful. So thank you. So we know at AFSP, this is a huge need, and we will continue to advocate for this bill. So we know that it didn't go past the committee, and the bill didn't continue. How do we ensure that, one, it is introduced the next legislative season? Do you know that if it is being introduced, or how does those types of things, I think our advocates are wondering. And then after you answer that question, please, I want to open it up to the floor. So if Sarah or Barbara or Julie has a question.
I think the 2 of us would agree that it's going to be introduced.
Yeah, it's going to be introduced. And really what we need from you is, are there changes, particularly in not the very first bill, but the second draft when we got the cell phone finalized? We'd really like you to look at those things and see what you'd like changed, because we want to do it better than we did it last time. We refine changes all the time. So look at those versions, see what you want in, and then start meeting with us, because we can start doing bill drafts right now. And then I think the other issue, and Judy and I haven't had the conversation, but maybe it shouldn't be us. Maybe we should get somebody else to introduce it. And so depending on, and you really can't make those decisions until after November, so you know who your crowd is.
Right.
But there's a lot of strategy on the second and third effort at a bill like this. And so start studying the bill, saying maybe we should change this language, and either of us can get official bill drafts at this point in time. And then in the end, we'll figure out who are the best people to get on the bill. We did a lot of that on 2149 too late. We could have done that in the summer. So timing is a really important thing.
Great, thank you. And I think Dr. Glenn wants to ask a question.
Yep,
go
this
ahead.
is Julie, and I'm in my car driving to the suicide fatality meeting. So sorry if there's extra sound.
How appropriate,
But-
yeah.
Yes. But one thing I have, it sounds like the biggest issue from the two of you just explaining things was the cell phone fee. Is there another, are you going to try the cell phone fee again, or is there another route for funding?
I can't think of a better way to do it than that. I mean, if you've got $1,000 phone, you can afford 30 cents a month, right? That's my
I
attitude.
agree. I agree with that fully, Judy.
So I don't think we're looking to reinvent the wheel with what 2149 is. We just want to streamline what's there. There was even a $2 million appropriation that was put in someplace in the middle of this fiasco, and it ended up with nothing. The original request was only $50,000. So I mentioned that to an appropriator this morning. And he said, well, I think we need to revisit this, and I'll sign on. So anyway, it's a matter of education in a lot of this. You could help, Julie, with talking to your colleagues too.
I will.
Yeah.
Definitely, I will.
Good.
Well, and I know in the end, as we got ready for the session, we realized that most states are doing the cell phone fee at this point, and I don't know the current status. That was really helpful when you guys could provide that information with FirstLink. Those are the resource documents that help us make those decisions. So the sooner you can get us that background information, because I know this is happening around the nation, and we can call NCSL, but because you do suicide, you probably can have access with your national association to get that for us.
One thing I read in my little refresher of myself in the last couple of days is that most of the bills that were introduced in the last session in other states died, and only one, California, had passed it. That I don't believe that that's the true picture. So if you can help us find out what states there are that do have a communications fee, that would be helpful. And we don't want any more than what it takes to run the program, but we've got to know what we have access to. So I requested this morning, Kathy, some information from Legislative Council. And I'm sure Ellen Knutson will be involved, but I said they should talk to FirstLink as well about how much of a deficit is there? What do we need in order to make this whole at this point? So I do expect that we'll have some information there in the next week or so anyway.
I think the other big thing that's happening is, so we get the call answered, you need that response issue. And when we have now gone, and I don't know if you're all aware, but we have gone to telehealth in every jail so that there's psychiatric telehealth available. I think there are 4 jails that don't have it now. And I think we will have that available, which is a resource, particularly in rural areas. It's not ideal, but it's psychiatric telehealth 24/7 everywhere is a huge addition to our response network. And the human service centers, who are in some ways first responders with the regional intervention systems, their crisis teams, who can, in some areas, do home visits and do response with ambulance people. We have to begin to build out that crisis response network, not just the telephone system. And I know many states are now trying to make sure they have integrated comprehensive response. For us, we are seriously looking at community behavioral health clinics. And that model of practice with federal standards and 3 of the regions, I think we hope will start to roll out this region. And this morning I met with Alana at Southeast about their crisis response. They only have 1 person on staff on 24-hour call for behavioral health in region 5, which covers all 25% of the population. Well, and they can't begin to cover the response needs with that. And so we have to look deeper into, so someone calls, is seriously suicidal. Many of them are still calling 911. And then we need the law enforcement. So there's a lot of systems work that has to be done. But I think there's a strong commitment to trying to make sure the suicide response is really more formalized and people are held accountable for it. That sound fair, Judy?
Yep. And one thing more that I was thinking about, because we know that we've had several suicides among people in rural communities, and You should be talking to the Farm Bureau and the Farmers Union because they are in every county. And the other thing is the Extension Service has offices in every county, and their job is providing information appropriately. Used to be how to raise crops and can and garden, but now it's way beyond that. So I think visiting with the Extension office, which is at North Dakota State University in Fargo, would be a really important thing to do because they have outreach into every single county, and they are respected by the rural communities whom they serve in large part. So much more so than I would be or Kathy would be if we went out to Slope County and we're telling them what to do. They don't care what we think.
Yeah.
You know,
But
I'm being realistic here. Yes.
Farm Bureau and Farmers Union have both had pretty significant mental health efforts in the last 30 years. And both of them have had targeted training because they know suicide in rural areas is impacting their members. And so those partnerships really are effective because those guys know how to lobby. They're good.
Oh, yeah. And there are a lot of them.
And there are a lot of them.
Well, this is incredible. I mean, this is way more than I think information and valuable information that we could have hoped for, especially when we look at what are some of the action items that we can take away from this. A brief side note, I will definitely look at reaching out to our national offices. I know we can get you access to some of the information that you asked for in terms of what other states are doing. That shouldn't be a problem at all. But I do want to do one last call before we kind of, have Sam wrap this up. Any questions? Sarah Dukart, I noticed you unmuted, so I'd love to give you an opportunity if you have any questions, because I know you're here on your lunch hour.
Yeah. So I work in psychiatry. I'm a psychiatric nurse practitioner, and I work in the emergency department as well. And so I was just wondering if we could put in like the statistics. I know like with 988, we had said like, this is how much percentage we've kept from having to go into emergency departments, like using that data to kind of try and push, saying by keeping, individuals out of emergency departments, we're saving money, because I know money is always like a huge part of everything, right? But also like you were talking about with like the resources, like we really are going to have to target multiple things because we just don't have enough. We don't.
Well, when I learned that literally on call for the Region 5, they only have one person responding. It's like, oh, that's not enough.
No, but workforce is such a huge issue here. It doesn't matter what the position is, whether it's skilled or unskilled. There aren't enough human beings working, and we have unemployment under 2%. So it's not that everybody's lying around. It's just we don't have enough people.
Well, and there was discussion about it in the old days. I used to work at Southeast, so I'm old. I mean, we used to require to be on call that you all had to have a master's or a PhD level so that you could actually do real assessments, and that they can't get them now. And the people at that level will say, I'll only work 8 to 5. And so then the standards begin to drop, but you still need supervision because suicide work is hard work. This is really, really hard work. And so there's the workforce challenges. That's absolutely real. And even if we had money, finding the people to do the work is going to be really hard.
Yeah, we're even using telehealth in the emergency department now. So after like 6, 7 o'clock, I think is now telehealth with psychiatry every day.
It's amazing, isn't it? Have you
That's the only good thing that came out of COVID was the reception for telehealth, but it is not the cure all. It's just what will we do without it right now?
Right.
Well, and the interplay of having the jails have access to psychiatric, that's a huge addition to our repertoire of resources.
Yeah.
Well, I think as we kind of wrap up things here, and again, I want to be respectful of everyone's time. I just want to kind of, again, just thank you so much to both of you, not just for joining us, but for, I think, this lifetime of work that you've embodied. It kind of freaks me out a little bit when you said that you have take 6 more years because, which is a good thing. And so we'll all be, breathlessly hoping that you're able to successfully pass the term limit, bill that you're talking about, Senator Hogan. But I think, again, knowing more in terms of what we can do to support you and the work that you do is extremely pivotal for us. So thank you for just being honest and for being so, I think, useful in just giving us a better picture of what we can do. Sam, I'm going to let you go ahead and wrap things up here for us.
Wonderful. So again, we learned a lot today. Thank you so much for sharing this great knowledge. For those of you online or who will be listening to this recording, they said it best, right? Know your legislators. Make sure you're going to the Action Center. Again, that's afsp.org/Action Center. Find out who your contact is, and that will help you get connected. As well as, again, we want to stay engaged with our leaders. When you meet with them, when you connect with them, make sure you're doing these things listed on your screen. And then in addition, you can find what your legislators are also doing locally in suicide prevention and mental health by signing up for their connections as well. So make sure you keep that in mind.
I have to tell you that we have no capital offices except during the session. It's our desks. And we have no local offices and we have no staff. So, well, what you see is what you get, as the old TV show used to say. And so our contact information is on the legislative website. So it's not hard to find out what our email addresses are and what a phone number is to get a hold of us. So that's the way to do it for us. And I don't know, I bet you Kathy and I both get contacted at coffee after church and in the aisle of the grocery store as much as anything.
Yeah.
So the good news is people aren't afraid to talk to us. Went in to grab a prescription today and a lady sitting in the hall said hello, and it turns out the same deal. I mean, she was waiting she had given a ride to somebody and she had something else she wanted to ask about as long as I was walking in the doors, so that just happens and we're fine with it.
Mm-hmm.
That's wonderful. Again, know your contacts, make that connection, and can keep that dialogue and that information going. So thank you. That's wonderful. And again, please use AFSP resources. There's a great Action Center. Again, you can go to afsp.org/advocacy resources. You can get lots of information. You can get training videos, including sample legislative meetings. If you're a little nervous on how to do that, there's training on that. You can also view the current laws in North Dakota and legislative priorities at the federal and state levels. You can read issue briefs on some of the top public area policy areas. And then also there's lots of great webinars and other tools. So please make sure, if you want to get involved in advocacy, AFSP, we're here to support you. Make sure you go to afsp.org/advocacy resources. And then, of course, our North Dakota chapter is very active. We do still have spots available for our CIS training tomorrow. You can go to afsp.org/North Dakota. We also have a Talk Saves Lives coming up next week at the Moorhead Public Library. You can get registered at afsp.org/North Dakota. And as well as we have tons of Out of the Darkness walks. Get involved. We have 10 across the state. Great way to get involved with AFSP. And we walk in Fargo. I know a lot of you in the Fargo area on September 22nd. Some of you, I know our advocates will be watching this later in Bismarck, afsp.org/Bismarck on September 8th. So make sure we have 10 Out of the Darkness walks across the state. Make sure you go to afsp.org/North Dakota and get connected on local events. And truly, I want to thank everyone who jumped on this call today, also our advocates and our legislative leaders for making today happen. And again, this is all about creating ongoing relationships. So thank you for advocating for our work. I believe that is everything that we have for you today. Again, just want to promote that Action Center again. Make sure you're reaching out to Sarah and I. We're here to support you, and we're really excited to have a very strong State Capitol Day in February. Sarah, is there anything else you want me to add?
I think you covered it, but thank you so much to you, Sam, as well. And we're looking forward to connecting with all of you over the next several months.
Thank you.
Thank you so much. Have a good day.
Bye, everyone. Thank you.